Did you know that Sir William Osler, born on July 12, 1849, is considered one of the greatest physicians of all time? He was actually given a nickname Pete and referred by his elderly patient, a poet, as an optimist and a prankster. He began his medical studies at the Toronto School of Medicine and spent most of his time in dissecting room or collecting specimens of polyzoa and diatoms. His first publication was published in 1869 entitled Christmas in the Microscope.
Quick trivia. While studying white blood cells on peripheral blood smears, he noticed small white masses which ultimately became the earliest identification of platelets.
Returning to Montreal in 1874, Osler accepted a post as lecturer in institutes of medicine. He rapidly became popular for his cheerful manner and uncanny ability to remember names and faces and to make all acquaintances feel like friends. His expanding clinical experience took him riding off in all directions. He investigated pernicious anemia, Bright's disease, Hodgkin's disease, ulcerative endocarditis, nephritis, and pregnancy, and a lot more.
He grew in a home well supplied with books. Reverend William Johnson and Dr. James Bovell, his two mentors, taught him to love books. A self-described bibliomaniac to the end, Sir William Osler arranged to have his ashes and those of Lady Osler entered in a niche of Osler Library, surrounded by the books he loves best.
The Baltimore merchant John Hopkins died in 1873, leaving Sir William Osler a shining, shimmering $7 million. This money is intended to establish a new university with a hospital and a medical school, and it was opened in 1876. Think, if you have invested them to me, I will give you a shining 10% per month interest. This is legit. PM Stephen Matthew Reyes for more info. Sorry for the short commercial.
During his Hopkins years, he continued to investigate clinical problems such as angina, aneurysm, typhoid fever, thyroid deficiency, and malaria. He was specially interested in typhoid, a disease that killed hundreds of Baltimoreans each year.
The Johns Hopkins Medical School opened in 1893, and this was the first American medical school that admitted women on the same basis as men. Wow! Women empowerment!
Meanwhile, in Leipzig, hey, I received a letter from Dr. James Tyson. He's from University of Pennsylvania Medical School. He asked if I would like to become a professor there in clinical medicine. I don't want this opportunity to slide. After several months of vetting, Ulcer took up his new post. Meanwhile, in Pennsylvania, bro, I no longer teach preclinical courses. I'm now handling clinical lectures, ward runs, and autopsies.
Oops, boring. The war started in August of 1914. Dr. Osler became physician-in-chief of the Queen's Canadian Military Hospital at Shorncliffe, a consultant to the American Women's Auxiliary Hospital at Paynton, and head physician at Canadian Red Cross Hospital in Clevedon. He was aware that infectious diseases had caused more deaths than wounds in recent military conflicts.
At his 70th birthday, he had a bout of bronchitis. Several months later, he came down with a more severe respiratory infection, probably influenza. The great influenza pandemic of 1918 to 1919 was not quite over. He developed pneumonia with pleurisy and lung abscesses during the next few months, and finally died on December 29, 1919.